Hello everyone, my name is Aileen Castellon. I am a student physical therapy assistant at CBD College, and welcome to my week 6 case review for PTA 420. To get started, I would like to introduce my patient. He is Andrew Marvins. He's a 76-year-old and he is diagnosed with progressive lower extremity pain. He is also non-insulin dependent and is experiencing numbness and tingling. To get started, I wanted to explain the importance of sensory integrity. And sensory integrity is important because it detects sensory stimuli needing to interact with the environment. Some of these stimuli include touch, smell, hearing, and taste. Sensory plays a big role for patients because it can ensure safety, it could help them monitor health and quality of life. Currently, Mr. Andrew's sensory integrity is not working properly. He expresses that he's not feeling any pain with vibration or pinprick on his distal leg. He's also expressing that he has pain when a cotton ball is stroked across his feet. So if Mr. Andrews were to get hurt or burned in his distal leg, he would be in danger of not censoring the danger due to the lack of communication of the body and the brain, which can prevent him from reacting from this pain. It is also important that we keep this in mind because this can affect his treatment plan, since he's also expressing some burning achiness, like feet on fire while walking. Therefore, getting him on his feet would be a little bit difficult with him. So let's keep on going. I want to now explain functional reach test. And this test is used to help test patients' balance and stability, and it could determine if they're a fall risk. During this test, we do ask the patient to stand and lean forward as much as possible without losing stability and moving their feet. When they measure this distance from the starting point to the furthest point of their finger, then we can determine if the patient is a fall risk. So for Mr. Andrews, his measurements was 5 inches, and a normal value for a male his age is 13.5. So this categorizes him as a fall risk patient. We also went over a Berg's balance scale test, and this is another test that also tests for fall risk. And for this test, we do require patients to do about 14 steps, which includes standing unsupported, sitting unsupported, or transfers, or sit to stands as well. And Mr. Andrews did score a 41, and that's also abnormal because the normal values is 56. The last test that we will be going over is the time up and go test, and this is also used to evaluate patients' mobility, balance, and fall risk. To do this test, we do require a patient to stand up from a chair, walk a short distance, turn around, walk back to their chair, and sit down. We start the timer as soon as they get up, and usually the normal value to do this should be about 10 seconds. For Mr. Andrew, he did score 22 seconds, indicating that he has poor physical performance and needs more assistance. So for exercises for Mr. Andrews, I want to include aquatic gait training, and this exercise would benefit him because we're trying to improve balance and coordination, and his values on the exams did come out abnormal, so that's why we want to work on this so he could improve and get out of the fall risk area. And I would instead do it in a pool because of the sensation that he's feeling of the burning of the feet, so that can help him feel a little bit ease from the pain and improve the mobility. The goal would be to at least do this 5 to 10 minutes, and a progression for this would be eventually getting him into an actual gym to do gait training. We also want to do some side lying clams, single leg raises, and these exercises would benefit Mr. Andrew because we want to improve his lower extremity score. He scored 4 out of 5 in a muscle manual test, and this means that he's able to contract and provide resistance, but when the max resistance is applied, the muscle is unable to maintain that contraction. So for him, we would start with 2 sets out of 10, and eventually to progress the sideline clams, I would use some resistance such as a band. And for the single leg raises, I could even add some ankle weight and have him do more reps if needed. To work on his balance, I decided to do a semi-tandem balance, and this activity would help address the balance issues. The goal here would be to have him stand up nice with great posture, with eyes open while he does this tandem balance test. And the parameters would be 2 sets of 30 seconds. To progress this exercise, I would still have him do a semi-tandem balance, but this time I would make it with a foam to make it a little bit harder for him. The last exercise that I want to include in his plan would be the sit-to-stands, and this exercise can also help address the balance and the coordination that he is having troubles with. And of course, we would be addressing the lower score from the Berg's balance scale. And having him do this exercise can also help him strengthen his hamstrings, glutes, and quadriceps. I would have him do a total of 2 sets out of 10, and the progression could be some mini squats. So as the progressions come with this patient, I want to be able to see some improvements in his balance. Like I said before, he's currently in the fall risk category. So strengthening the muscles would really help him. And I want to see increase in the reps as well, and making the exercise a little bit difficult for him. Another way that I can see any progression would be redoing some of the tests that we already did. So for example, if I see an improvement in the Berg's balance scale, then I would be seeing a progression in this patient. So I hope that this video has been helpful for all of you. Thank you for watching, and see you next time.